At its core, healthcare PR is no different from, let's say, consumer public relations or tech PR. The idea is the same, to facilitate dialogue and the exchange of info between one organization and a group of people that could benefit from that information. But in healthcare PR, most of the time the audiences are patients or doctors or insurance providers, and the information is about a potentially life-saving treatment or innovations in a disease category or information that can advance the industry or really improve a patient's life. However, the devil is in the details. Healthcare PR is nuanced and highly regulated. In the US, the Food and Drug Administration oversees all communications about treatments for patients. Yeah, this is necessary to protect public health, but these regulations have unintended side effects on communications. If a company violates any of the FDA's regulations, it can cost them a lot of money, and more importantly, can drastically affect the perception of their company or its brands. In some extreme cases, it could open the door for litigation or even prevent the treatment from ever making it to patients. Because of the intense pressure to follow the rules, healthcare marketers are often forced to play it safe. Strategies and tactics that push a company to give up control carry an even greater risk for healthcare companies than they do for others. As a result, the industry has been slow to adopt new tools and tactics. Healthcare has been struggling for years to understand how to use social and how to use digital media. The challenge is really understanding how we could have meaningful conversations, but also follow the rules. In fact, the FDA is just now starting to weigh in on appropriate ways that a company can use social. So where does this leave us? Honestly, it just leaves us a few years behind everyone else. The good news is that it's an exciting time to be in healthcare communications. As healthcare struggled to catch up, the world was evolving. Over the past years, the world has changed so much that we can no longer ignore strategies that lead to genuine and real conversations. The best news is that healthcare marketers have started to realize the same thing. Earlier this month, Ogilvy teamed up with medical marketing and media to field their annual Health Marketers Trends report. We found that larger percentages of budgets are being allocated to communications that speak directly to patients and physicians. Even more, PR and social media were two of the most widely used approaches in the industry, more so than print, broadcast, and digital ads. Patients are calling for even greater levels of authenticity and interaction. I'm happy to report that the industry is making a strong and real effort to achieve this, but we still have a lot more work to do. When it comes to healthcare PR, we need to get back to basics. As the industry continues to dip its toes into social media, we need to ensure that healthcare communications does not lose sight of what brought it to the dance, a foundation rooted in strong and well-developed media relations. As part of the same trend report, we asked marketers to look at areas that they thought were of the greatest opportunity. A majority saw customer behavior change as the number one, and more than half said the same about social media. Yet only a quarter perceived mainstream media coverage as being an area of opportunity. That's the gap that we need to close. As marketing strategies become more closely integrated, the cohesion of an organization's story is more important than ever. Public relations and a well-thought-out media effort are the thread that tie together the elements of a healthcare marketing program. From advertising to social and even to data communications, all this put together lead to the behavior change that organizations want to see from their audiences. Healthcare communication plans need to go through levels and levels of review. It's not rare to see one piece of content reviewed by marketing, by legal, by medical, by regulatory, and any other expert at a healthcare company. When communicating info that might affect a person's health, it's absolutely necessary to do so in a responsible way. So you need to make sure that everyone in an organization is comfortable with what's being said. However, the approach of media relations is familiar to many healthcare organizations. They've been doing it for years, and they might be more comfortable with media than they are with, say, social or digital. But just like social media, media relations efforts allow you to have authentic conversations with influencers in a particular group. PR allows organizations to become used to the idea that they can gain a greater reward just by taking a little bit of risk. And then once the story is set, you could supplement your media relations with social extensions, and it's a great way to introduce new tactics and strategies into a healthcare organization that they may not have tried before. This all leads to a unified communications front that could get information to the intended audience when they want it. This means more informed patients, doctors with access to cutting-edge info, and healthcare companies that better understand the audiences that they serve.